Okay, this video is PCOS reversible? Polycystic ovary syndrome. And we start out here with this beautiful painting called The Lifeline by Winslow Homer from 1884. So basically the ship has crashed and they're saving them with this pulley rope, and the man is anonymous, like saving the woman. And basically here's your chance to be saved, ladies, maybe, I hope, with this knowledge. You know, I'm not your doctor, but I can give you knowledge I think that might help you. You go share this with your regular doctor and educate yourself. So anyways, great painting. Okay, what do we know about PCOS? Well, I was talking to this cute young lady yesterday who's got PCOS, and I told her no meat, not one bite. And she gave me this bratty little look on her face and said she's not going to stop eating meat. And I'm thinking to myself, she does not understand. You know, 5 years from now, she could be a happy mama with a baby on her boob, or she could be in an ICU on a ventilator dying from an autoimmune disease. Okay? It's serious business. You don't want to mess around. Early on in the disease process, everything is typically reversible. You can often be cured 100%, get on with your life, and forget about these problems. On the other hand, the more a disease becomes chronic, the more it starts to damage the body. For example, if you got chronic insulin resistance, you'll end up destroying your pancreas and then you're insulin dependent. Not good, okay? Typical PCOS, so polycystic ovary syndrome patient, is reproductive age. They're typically fat. Typically they got facial hair, hirsutism. They usually will have elevated free androgens, free testosterone. For example, that can be associated with increased acne, can be associated with male pattern baldness. A seldom used term more formally for PCOS can be hyperandrogen anovulation, okay, but everybody calls it PCOS. Blood tests, elevated free testosterone. The other thing too is they'll say, oh, it's genetic, you know, often all those sisters will have it. Well, don't ever jump to genetic. You know, maybe there is a genetic component, but don't jump to that because, you know, why are all the sisters fat? Because they all eat the same food, okay? They all got the same risk factors typically. Big mistake to blame things on genetics. That leads you down the path of hopelessness, despair, and poor outcomes, okay? Always you want to say, it's my fault, I screwed up, because if it's your fault, you screwed something up, usually you could fix that. You just stop doing whatever you did before. Okay, and by the way, there's a psychological issue with these diseases. I know female doctors with PCOS who know I'm, you know, pretty knowledgeable about nutrition, and they never talk to me. You know, I'm not going to approach them and say, hey, you know, you look fat with facial hair, you probably got PCOS, I can help you. You know, I don't have the social skills to pull that off, but I can just tell you, you know, they act like there's nothing wrong, and they never talk to me about it, and these doctors, they don't know anything about nutrition, so they can't help themselves. And then the other problem is they'll go to like the professional health sites. I'm telling you, I went to a bunch of university, famous medical center health sites on PCOS, and they're a joke. Okay, they go, well, nobody knows what causes it. It's partly genetic. And here, we can help you. We'll do electrolysis. We'll remove your facial hair. We'll give you fertility pills so you can ovulate. And the reason why I think that's a stupid joke is because what you really want to do is get better. Fix the problem so you don't need to take any pills. Let's see. They often have infrequent periods. The medical word for that's oligomenorrhea, like less than 9 a year. Abnormal periods as well. Infertility is a very common problem for these women. A lot of them, you know, they're not able to have a baby, and that can cause problems with their marriage. You know, the husband wants a baby, she can't have a baby. They might get divorced because of that. In those who are able to get pregnant, there's increased risk of problems with the pregnancy. You know, she'll get real fat during the pregnancy with gestational diabetes or high blood pressure. That can increase the risk of having complications with the pregnancy for the baby and for the mama. If you look at these things on ultrasound, I've seen plenty of these. They got big ovaries with lots of follicles in the periphery. You call them cysts, polycystic ovary. That's where the name comes from. And these ovaries are making abnormally too much androgens. And the adrenals could be doing that as well, the adrenal glands. Okay, so here's a rule of thumb to remember. You want to live like Adam and Eve, except with the modern benefits of indoor heating and indoor plumbing. Okay, thank God for those things. Those are the best things in the modern world. Most other modern world stuff is BS. Okay, don't be fooled by it. You want to eat stuff that grows outside, plant foods. You got flat teeth, eat plant foods, okay? No meat, including you, young lady who I spoke to yesterday. Okay, we're designed to do that. That's why we got flat teeth. That's why our jaw goes side to side, etc. Let's see, what else? You know, they walk around outside, they get some sunshine, all that. All right. It's a beautiful painting. This is my favorite Adam and Eve painting. This is one by Jan Bruegel and Peter Paul Rubens from 1615. It's beautiful. Okay, typical PCOS patients eating a SAD diet, a high-fat diet with processed food. This leads to obesity, leads to insulin resistance. Okay, the insulin resistance causes also hyperlipidemia in the blood, high blood pressure. They get a fatty liver, and that can progress to liver failure, cirrhosis. It'll progress to type 2 diabetes pretty routinely. They're making high insulin amounts because of the insulin resistance. Well, hyperinsulinemia causes all kinds of problems. The high insulin will lower steroid hormone binding globulin. That's a binding protein in the blood, like a transport protein. And when the steroid hormone binding globulin, SHBG, is lowered, what that means is the free testosterone goes up. And when the free testosterone goes up, they're going to get more male-like side effects, more body hair, potentially male baldness, okay? Alopecia, that's sort of a medical word. Insulin is a mitogen. By mitogen, that means it increases the rate of mitosis, cell division, cell replication. You don't want that. If you speed up the rates of cell replication, you accelerate aging towards reaching the Hayflick limit. You also increase the risk of replication in a cancer, cancer of the uterus, cancer of the breast. Not good. PCOS patients are fat with an increased tendency towards obstructive sleep apnea. It's where they stop breathing intermittently at night. It causes hypoxia, meaning less oxygen delivered to the brain. Over time, that can cause cognitive impairment and dementia. It makes you stupid. You don't want that. It can also increase daytime sleepiness, which will decrease your ability to perform a job, a sport, or anything else that you want to do. It's not good. Okay, and you know, the typical person just goes, well, I'll get a CPAP mask. Okay, fine, but why not lose the weight? Well, everyone thinks it's impossible to lose weight. It's easy to lose weight if you eat a low-fat vegan diet, okay? Look at all these Asians, rice-eating Asians. They're all skinny. When I was in college in California, I never once saw a fat Asian. Okay, rice-based diet. I had a friend, you know, he's totally fit wrestler, Asian guy. He's eating rice 3 times a day. Okay, like I said, I went to the famous medical center websites, and they say the cause of PCOS is not clear. They're a joke, okay? Don't be fooled by that. The problem is the conventional medical system in general knows nothing about nutrition, and a lot of these diseases, they're nutrition-based. They're dietary diseases, so you need to learn something about diet, all right? But the good news is once you do, you'll be amazed at how good results you can get. And it's because we're made to eat this way. That's why lots of health problems improve when you eat this way. So for PCOS and most other things, the best diet is a low-fat diet, low sodium, 100% vegan, only plants, whole foods, real foods, not packaged crap, organic only. Why do I say organic only? Because corn is routinely sprayed, non-organic corn, with atrazine. That's a very powerful estrogenic chemical. That's the one that turns male frogs into female frogs. And you don't want that stuff sprayed on your food. You don't want, these PCOS women have problems with their hormones. They don't want these external hormones affecting them, okay? Like atrazine sprayed on the corn. You don't want like the stuff, the Roundup sprayed on the soy foods, okay? You don't want that crap. No processed food, none, zero. If you can't afford to buy organic food, at least only get whole foods, all right? That means intact foods, things that Adam and Eve could eat. Remember Jack LaLanne, the famous super fit exercise guy? He said, if man made it, don't eat it. Anything from a factory, anything packaged in a package with more than one ingredient, never eat it. The most processed food I would ever eat is plain oatmeal or plain quinoa, just plain, and eat it with water. If there's 2 ingredients, they could be throwing MSG or some other crap in there. You don't want it. So here's what I'm saying about me. None of this in moderation. If you want to be a half-assed loser, go to some other website. This is my YouTube channel is for people who want to be successful, for people who want to be their best. I do not suffer fools gladly, and I don't like half-assed losers. If you want to be a half-assed loser, go somewhere else. This is for people who really want to be success. No meat, not one bite. No meat, not one bite. The reason is you've been eating crappy for years and your body's full of toxins, things like you're iron overloaded typically. You got other herbicides and pesticides accumulated in your body. You got all this stuff in your fat tissues. A lot of these persistent organic pollutant chemicals are in your fat. So you want your body to be free from all these animal foods. Animal foods just have a lot of problems with high estrogens. They change estrogen metabolism in the liver. They'll keep you sick. You want to take a big step because you want to get better. You don't want to be screwed. Polycystic ovaries associated with increased risk of autoimmune disease, including hypothyroidism, like Hashimoto's thyroiditis, and potentially other autoimmune diseases. Patients with one autoimmune disease often have multiple autoimmune diseases, like they have increased risk of lupus, multiple sclerosis, Crohn's disease, all these diseases, which can really ruin your life and cause you to die, okay? When I was young, I was in love with this girl, and her mother had lupus, and they asked me if I knew anything to help, and all I could say when I was a young guy, like a medical student, was go see the best, rheumatologist. I didn't know anything about nutrition. I didn't know about leaky gut. And I was sad. I could have saved that lady. Her mom was a really smart lady. She was a biochemistry professor. And so I didn't know because of my ignorance. She died from lupus. It was awful. Let's see. What else am I telling you? So I'm telling you, don't mess around. Take this stuff seriously. Don't listen to all, I say more than 95% of the nutrition information you see on the internet, it's all BS, a bunch of liars and idiots paid off by big food to tell you this low carb crap. One of these big med centers said low carb. Forget about low carb. That's just a disaster, okay? These big med center websites are going to tell you, we don't know the cause, eat a low carb diet, take our pills. That's all crap. Just for your own sake. Low fat vegan, not one bite of meat, not one bite. It's like an alcoholic, then you can't have one drink. A smoker, they have to quit cigarettes. You can't have one cigarette. I say these because I want you to be successful. Half-ass does not cure people, okay? Let's see, what else? I call it the Spartan Vegan Diet. I got videos on Spartan Vegan. That's what I do. That's a very simple version of this low-fat vegan diet. If you want, there's plenty of people out there that know how to make it more fancy if you want that. You can explore that on later, but I'm just telling you, has to be no meat, not one bite, because that screws up your estrogen metabolism, screws everything up eating animal fry. And when I say no meat, it doesn't just mean no beef, it means no fish, no fowl, that means no chicken, no turkey, no dairy whatsoever, none. And that includes skim milk, that includes yogurt, it's all bad. Cottage cheese, it's all bad. No oil, not one drop. That's why you can't eat any processed food. Almost all the processed foods have oil and MSG in them. They're bad. You don't want to eat that crap. Plus all kinds of unknown chemicals just make you sick. No alcohol, not one drop. Alcohol increases your risk of breast cancer. There is no safe, good amount of alcohol. All that previous stuff about a drink a day is BS. It makes people sick. Increases the risk of cancer. You're pouring a tumor promoter right over your mouth and your throat and your esophagus. Terrible places to get cancer. No caffeine. I recommend that. You'll sleep better. You'll get healthier faster. If you make these big changes, you'll have big improvements faster, and you'll have some joy in that. That's what you want. If you go half-ass like the typical stupid person, everything in moderation, how idiotic is that? I'll put good food on one half of my plate and bad food on the other half of my plate. Do not use social thinking when you're talking about health. They don't go together. You put good food on both sides of your plate. Okay? None of this social thinking, everything in moderation, go with the flow, when in Rome, do as the Romans do. That's for losers and screw-ups and unsuccessful people. You don't want that. You want to be successful people. A successful person, only put good food on both sides of your plate. Filter your drinking water, okay? I got separate videos on filtering water. We're not going to go into all that right now. Avoid the high-fat stuff. Don't be conned by all the BS promoting nuts and seeds and avocados on the internet. There's real problems with that food. They'll make you sick and they'll keep you fat. Let's see, what else? We talked about the autoimmune disease component. So it's a good idea also, because it appears that it might be associated with these autoimmune diseases. Certainly the diet that people eat to get it is. You want to, I got videos on how to avoid leaky gut and other causes of autoimmune disease. So I get the best video on that is leaky gut checklist. I have a whole checklist of, a playlist of autoimmune diseases. So try that stuff out, keep reading and learning, and if you're taking any medicines for diabetes or hypertension, make sure you work with your doctor, because you're going to probably need to titrate those dosages down. So I wish you well. Study your disease, look up people on the internet that have gotten better, and you're going to see low-fat vegan, 100% vegan. None of this vegetarian crap where they eat some animal foods. Vegan, 100%, in whole foods. And I'm optimistic for you. Can't guarantee you anything, and and I'm not your doctor. I'm just teaching you about this condition. But like I said, 5 years from now, do you want to be happy and healthy and skinny and as beautiful as you can be, or do you want to be, sick and getting sicker? All right. Hope that helps.